Acid reflux or heartburn is a high carbohydrate condition. And yes, your doctor is wrong in treating you with punto pump inhibitors. Please allow me to explain. My name is Dr. Enin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. Today, we are going to be talking about acid reflux. So what is acid reflux? It's simply when the content of the stomach comes inside of our mouth. Now, God designed the body such that our stomach remains acidic between a pH of 1 and 3. So we want good amount of acid in the stomach and we want it to be very acidic. Now, when the stomach is that acidic and has good amount of stomach acid, there is a sphincter or a muscle band here that closes up. And once that is closed, the content of the stomach doesn't come inside our mouth. It acts as a barrier between the esophagus and the stomach. So we want low stomach pH and good amount of acidity. We don't want low stomach acid. So anytime you have low stomach acid, it can cause this LES or the sphincter to open up and cause the contents to come out. So we want good acidity between a pH of 1 and 3, and we want good amount of acid in there. An alkaline environment in the stomach, a low stomach pH will cause this to relax and open up, and that is not what we want, and that can be a problem. Now, the stomach is made up of endothelial layers called the columnar cells. Those are tall cells that are able to handle the acidity of the stomach. The esophagus, on the other side, has squamous cells that doesn't handle acidity that well. So in other words, we don't want to be putting a lot of acidic stuff down our throat. It can be a problem because when you continually do that, we change the endothelial layer of the esophagus from the squamous cell to a columnar cell, and that is another condition called the Barrett syndrome, and that's not what we're going to be talking about. So in other words, we don't want a lot of acidity going down our throat, and that is why people using apple cider vinegar is only for short-term purpose. Yes, we can use it on our salad and all those things, but we are not supposed to be drinking down our throat acidic stuff because that changes the dynamics of the layers, and that can be a problem because the esophagus is not designed to be dealing with acidity like that. So that is just the distinction between the lining of the esophagus and the lining of the stomach. A lot of things can cause this to relax. For example, we need potassium, we need zinc, we need vitamin C, among other things, to make the acidity of the stomach, which is the HCl or the hydrochloric acid. So all those things are needed to make the stomach acidic. But the primary cause of a lot of issues with stomach acid has to do with the chronic intake, the chronic consumption of carbohydrates. Because when we ingest carbohydrates, it goes inside our small intestine. When it gets undigested or it's not digested well, it goes inside our colon and it's fermented. And this fermentation process produces a lot of gas. And this gas causes the sphincter to relax. And once